How low should LDL cholesterol be lowered, and for how long? I think it's easier to answer the second part of the question first, and that is that to lower cholesterol, because you're trying to prevent cardiovascular disease, once you start lowering cholesterol, it's for life. So these drugs, once started, should be taken for the rest of your life. You could ask then as to when should you start them, and that would depend. In very high risk inherited forms of high cholesterol, we start statins at aged 6 to 10, and certainly in teenage years, and you keep those patients treated for the rest of their lives. In terms of how low should we lower cholesterol, there are guidelines in the rest of the world, and in fact, even with the new guidelines in the US, the American College of Cardiology and American Heart Association guidelines, while they don't give you specific targets to aim at, if one reads the guidelines carefully, they do imply that there should be specific levels. People with coronary disease or very high risk for coronary disease should start LDL lowering with a statin, presumably another drug if you can't tolerate a statin, if your LDL is above 70, and you should aim in those patients, based on their clinical evidence, of at least a 50% LDL reduction. So to me, that means that if you start with an LDL above 70, your goal of therapy is to get below 70. And if you start at 70 or 80 and you need a 50% reduction, that's an LDL of 40 or 50. The guidelines also carry a suggestion that one should down titrate or reduce therapy if LDL drops below 40. So that gives you a rough guideline as to where you should be, even in the US guidelines, where they suggest you start therapy above 70 and that you down titrate if you drop below 40. In effect, that means that they believe from the guidelines that the optimal LDL in these high-risk patients is somewhere between 40 and 70. So that's no different from the rest of the world in Europe, where the guidelines are less than 70 for high-risk patients, or less than 1.8 millimoles. So we think that LDLs around about 40 to 50 are safe, and there is data that suggests that those levels will also result in better reduction in cardiovascular disease risk.